The Aphasia Recovery Connection Part 2. The Aphasia Recovery Connection claims that aphasia has the largest negative impact on health-related quality of life issues out of 60 diseases and 15 health conditions in a large cohort of individuals living in long-term care. Use of the telephone is an example for us. We have 3 phones scattered around the house. When the phone rings, if Diane accesses it, she often fumbles with it to try to turn it on. If she figures that out, she will listen, and then bring it to me. I will turn on the speakerphone so we can all hear what is going on. She is unable to make her own calls. Thus, besides aphasia, her communication is hindered again, and she relies on me to make connections. We often do not appreciate our abilities until they are lost. Communication is an essential need for day-to-day living, social connections, security, and peace of mind. It must be difficult for immigrants who do not speak our language. Diane knows what she wants to say, but can't get the words out. The Aphasia Recovery Connection stresses that there is a common misconception that if a person has difficulty with speech, they also have intellectual difficulty. They claim that is simply not true for most. Diane, having Alzheimer's as well as aphasia, presents a big challenge. Because Diane may not be able to express basic wants and needs, aphasia is distressing for her as well as her family and friends. Because of the size and location of the stroke or brain injury, no two people with aphasia are exactly alike. Again, Diane's situation involves double jeopardy because of Alzheimer's, and she has problems with speaking, reading, writing, and understanding. She used to belong to a book club, but her reading has greatly diminished. She has trouble writing her name. She is confused about simple tasks. As ARC suggests, we engage in speech therapy to combat aphasia. Diane has regular meetings with a speech therapist. I have learned to be patient. I must give Diane time to think and respond. I can't rush her. I can't interrupt. I say, take your time. ARC suggests we simplify our talk. I should stay on one topic and speak in short, easy sentences. I must remember not to talk too fast. Also, I often jump in with prompts, not a good idea. I need to allow Diane to make the effort if she is able. I must encourage independence, but it's not easy. ARC suggests background noise is distracting for many with aphasia. I turn off the TV and the radio. I try to establish eye contact and remain focused, but this is another difficult task because she takes so long to get words out. Again, she is so often obsessed with, "Where's Mike?" that I want to scream. Shouting and screaming is not helpful. Next, ARC suggests we think out of the box, use pictures, gestures, and even employ a hug that can speak volumes. I'm good at the hug part. Often, I will say, "Did you get your morning kiss yet?" And she will respond. Of course, I milk it with mid-morning, afternoon, mid-afternoon, and any other time frame I can think of. ARC warns that those with aphasia often have difficulty answering open-ended questions. They recommend yes, no questions and questions with limited answers, i.e., do you want this or that? Visual supports such as using thumbs up or thumbs down may be helpful in confirming responses. Pretend you are at the Colosseum in Rome watching gladiators. Surprisingly, Diane is often able to comment on news events, so I must respect her efforts to stay abreast of world events. I have discovered that YouTube videos featuring song and dance work well. She will often get up and dance. ARC encourages us to learn the strategies that work best and share them with others such that your friends and family understand aphasia and your loved one can still feel included. To create these YouTube videos, I use AI software called Pictory, which offers 3 5-minute freebies. It's easy to use, provides voiceover, captions, and great video pictures to accompany your text, so give it a try if even for the freebies, as it adds promo spice to your website, FB page, etc. If you decide to purchase it, enter this code, KNQW7inches for a 20% discount. I appreciate your subscriptions at no cost, and thanks for your support.